Hello, I am Dr. Marshall Better. I am here today to help you understand Axon Therapy using magnetic peripheral nerve stimulation, also known as mPNS. Axon Therapy uses a magnetic waveform instead of the traditional electric waveforms seen in all other neuromodulation devices. This treatment is non-invasive, non-painful, with no implants needed. It delivers a strong, low-frequency waveform of 0.5 Hertz. This has been shown to produce an initial neural blockade, which greatly enhances the initiation of peripheral reconditioning of the central nervous system. The Axon Therapy device consists of a magnetic liquid-cooled generator on a rolling cart with an attached coil and built-in computer to guide therapy. The device and computer are turned on both at the generator and at the computer, and patient information is entered here into the computer. The actual articulated arm with the coil is then positioned over the peripheral nerve that has been selected, correlating to the area being treated. The power of the pulse being delivered to the nerve is controlled by the controller wheel attached to the handheld coil. Axon Therapy is FDA-cleared for chronic neuropathic pain, postoperative, post-traumatic, and painful diabetic neuropathic pain. Here I will treat the femoral nerve, which is the desired location to successfully treat pain at the knee. At the femoral nerve position, starting there, we may be treating postoperative knee pain, post-total knee arthroplasty pain, CRPS, post-amputation pain, and even phantom limb pain. Once we have determined which nerve we will be stimulating, depending on the underlying diagnosis, the patient is positioned in the appropriate manner on the examination table, making sure they are comfortable and areas are padded accordingly. The machine is positioned close to the patient so that the articulating arm, seen here, can be utilized at the appropriate height with easy access to the nerve being treated. The upright control arm should be maintained close to the side of the generator box to decrease any movement of the wand when the pulses are being administered. I maintain one hand on the ball joint, this is the tightening handle, and one hand on the wand as I am mapping. And I'm able to control, again, the power level and the activation button as I place this coil over the best position over the nerve that we are treating. And I can then map by gently tracing along where I believe the nerve is located to actually identify the sweet spot by the paresthesia and the nerve contraction that we activate. After a threshold level of correct paresthesia is seen, we can increase the power to as high as tolerated for best results. A full treatment is then initiated, lasting 13.5 minutes. Treating diabetic painful neuropathy, DPN, is most often performed with the patient prone, as you can see, and with the handheld coil starting in the popliteal fossa. The sciatic nerve splits into two main branches near the back of the knee at the popliteal fossa. This rhomboid-shaped space serves as a conduit for blood vessels and nerves in the leg. The fossa is located slightly above the joint fold at the back of the knee. The sciatic nerve bifurcates into the tibial nerve and the common peroneal nerve, which supplies the lower leg and foot. This is where mapping is performed to localize paresthesia corresponding to the existing pain in either the distribution of the tibial nerve or the common peroneal nerve, which usually innervates more outer and anterior aspect of the leg and foot. Understanding the anatomy of the sciatic nerve and popliteal fossa is crucial for procedures like a popliteal nerve block, which are used to provide anesthesia and analgesia for procedures below the knee, and similarly important for us to map out the paresthesia distribution to best capture the patient's painful region. We can also stimulate at the ankle superior to the medial malleolus for a medial tibial nerve, or at the lateral malleolus for the lateral saphenous nerve if needed. I hope this demonstration allowed you to better understand the basic underlying concepts and techniques for Axon therapy. For further information, please contact the numbers on your screen.